कैसे हैं आप सब लोग? Am I audible and visible to you all? Am I audible and visible, guys? Hello, guys. Good evening. Good evening. I think it's audible now. Am I audible? Audible, visible? Yes, had my lunch. We are not able to hear you. Akshata, dear, I think please check your connection. Most of the students are able to hear me. What you had, sir? Afternoon, I keep it little light. Pappu rice is enough. Okay, so let's start with the session, guys. I hope all the students have joined now. Let's continue. So today's topic, we will start with a new topic today, guys. Today's topic is planes and axis. Good evening, everyone. Good evening, good evening, good evening, guys. Good evening. Good evening, everyone. On YouTube channel also, everyone. Good evening, guys. I hope you are having a fantastic day. Sir, do we have to learn all that prefixes and suffixes? Yes, beta. Whatever the PDF, that prefix and suffix is actually 100 words, and that is not enough though, because too many words are there. But what I have done is that I have compiled 100 important words which are more frequently used in your biology subject, especially more used in zoology also. They will be also utilized in your what do you say, in your botany subject as well. Yes, beta. So you didn't share the PDF. Yes, beta. There was some problem in sharing. Okay. So once this introduction part completes, I will share with you all. Okay. And then you can study. Take your time. You will have some holidays also. And in the holiday also, you can go through the words and learn them. Okay. It's not basically learning, it's understanding. Less of learning and more of understanding is there. Now coming to so we need to study all or some. See, you have to go through all. You have to go through all the words, the prefix, suffix, and root. These are the 100 most commonly used words, what I've segregated. Okay, I have segregated those words that you are going to study. There is more than that. There is more than that. But these are enough for your starting. Slowly, slowly, more words will add. Don't get afraid, because your vocabulary will develop. Okay? Being a medical professional, there are so many words. I myself only know 1% of words. No one can say that they know all the words in medical profession or in zoology or in the whole biology. There are so many words. But the words which are most important, which are basic, which helps us to understand, relate the topics, relate the subject, relate in the sentence, that what I have given to you all. Okay? Now, going with the next topic. Chandrakala Divi, sir, I am getting right now 450 to 500. Can I get 570 within the 30 days? Why not? 450 to 500 is a very good number. So you can easily cross 600 to 650 marks. No issues. Okay, just find your weaker section, weaker areas. Find your weaker area, work on that. You will definitely learn. So today's topic, okay? Students are talking about what is today's topic. But before going into the today's topic, let's have a small question answer round, that whatever you are remembering from yesterday's class. I hope little kuncham you are retaining whatever we have learned yesterday. Okay? So what is the suffix itis means? I have not given the PDF to anyone, guys, till now. I have not given the PDF, so don't worry. My question was, what is the suffix itis means? Okay, today's first question. What is the suffix itis means? Come on, guys. What this suffix means? Come on. Very good. Many students are answering on YouTube also. Correct answer. Inflammation. Vaishali, Jagdish, Bhumika. And here also Divya. Now so many students are answering inflammation. Inflammation is the correct answer. Correct answer is inflammation. Come on. Now tell me, what is the meaning of inflammation? What are the 3 to 4 basic words in inflammation you will relate to? Tell me. What are the 3 to 4 basic words? Any tissue having inflammation. What are the 3 to 4 words? Yes, swelling is there, one word, very good. Pain is there, very good. Redness is there, very good. Redness, pain, swelling, and sometimes loss of function for little time. Imagine you had your finger stuck in between the hinge of the door. Sometimes by mistakenly we put our finger near the hinge of the door and sometimes it gets squished and suddenly a lot of pain. So you are worried that your finger is not able to move. It gets swelling, it gets red. The redness, swelling and pain is inflammation. And inflammation is the most basic thing whenever a tissue or organ is affected, either by infection or either by some other disease. Exactly. Now, what do you mean by suffix "ase"? What do you mean by the "ase" suffix? Come on, guys. What do you mean by "ase" suffix? Come on. Answer, answer, answer. Come on. "Ase" means enzyme. "Ase" is a suffix for enzyme, rightly said. And we know that in our body, all the metabolic reactions, is based on enzyme. Without enzyme we call it as biological catalyst. Catalyst which helps to accelerate the rate of reaction. Similarly, in our body also, the reaction is regulated by the enzyme. Am I clear, everyone? Like correctly said, many are saying salivary amylase, many are saying lipase. Very good. Now, sir, what is taxonomy? Very good. Now, taxonomy, a doubt has came here, taxonomy. So guys, taxonomy has 2 words. Come on. Taxonomy has 2 words. One is taxo. Taxo is coming from the word taxis. And nomi means name. Nomi means name. Nomi means name. So taxis means arrangement. Arrangement of organisms, either plants or animals, as per their similarities or dissimilarities, and also giving them their name. That is nomenclature. So taxonomy is basically classifying organism based on similarity, dissimilarity, or arranging them in a proper order and giving them a name. So that is taxonomy. Am I clear, guys? Related to taxonomy, you might have studied this binomial nomenclature, how to name organisms, giving 2 names to organism. One is the genus, another is the species. Yes? So that is there. So that is connected to taxonomy. Okay? Next. What does the prefix "an" means? An or non? What does an or non prefix means? Correctly said. An, non is without, absence. Absolutely right. What is the meaning of ana? What is the meaning of ana, guys? Ana means going up, anabolic, making something up, from simple to complex. Similarly, what is opposite of ana? Ana opposite prefix word, come on. Ana opposite, catabolic. Cata means going down, breaking down the complex into simple. Clear? So see, slowly we are going to build up these words, and now we will start with the today's topic. So pretty much I am very happy that you are retaining yesterday's whatever knowledge was given to you. Okay, now we will go ahead. What is the topic today, guys? Planes and axis. Planes and axis. When you are going to study a human body, in human body, when you go in the first year MBBS, first year BDS, you are going to study a very important subject, anatomy. What is anatomy, guys? Tell me, come on. What is anatomy? Come on, explain me. What is the meaning of anatomy? Anatomy is study of internal structure. Arey bhai, someone is writing studying of dead body. No, not necessarily dead body. Yes, you are studying a dead body to study anatomy, but anatomy is study of the internal structure. Whatever you externally see is the morphology. Whatever externally you study is morphology. Whatever you study internally is anatomy. So in the first year, very important subject, anatomy. Head, face, neck, upper limb, lower limb, all the different body parts, anatomy you are going to understand. You are going to get a cadaver. What is a cadaver? Cadaver is a dead body, someone who has donated it for medical study purpose. So in that body, you are going to understand the positioning, the anatomical positioning, how organs are positioned, how bone is positioned, how artery, vein, capillary, internally, how they are positioned. Then only you will become a good surgeon. Yes. So for that anatomy, you should be very well knowing the planes and axis topic. Very basic topic, very basic understanding. But we have to understand what is planes and axis. Okay. So talking about planes, what do you mean by planes? How many planes you can see? Come on, guys. Tell me how many planes you can see in this picture. Come on. Tell me how many planes you can see. Is it 1, 2, 3, 4? Come on. The names are already written. Tell me. Come on. What are the names, guys? Yes. 3. Frontal plane. Frontal plane. Sagittal plane. And transverse plane. Yes. These are the 3 basic planes which we are going to study. Sir, but why this is required? Is it important to us? Yes. Because when you see an organ, like if I give a brain to you, you can cut a brain in frontal plane, you can cut the brain in sagittal plane, or you can cut the brain in horizontal plane. Imagine a brain is in front of you, you can cut it in sagittal plane, cut it in the frontal plane or horizontal plane. And all the 3 planes, when you look, you will see different structures. So basically these planes help us to understand the formation of a particular organ or location of the particular organ structure, how things are arranged. That is very important. Am I clear? So let's go in more detail. Basic first thing we have to understand. So why we are studying this? To understand anatomy. So when you go into your anatomy classroom, you will have a cadaver cadaver lying in this position, lying on the back side. Yes, palm facing upwards like this, head facing upward. Or is it upside down? It's not upside down. Face in front, palm facing in front. Cadaver is a dead body which we study for medical purpose, understanding the anatomy. Am I clear? So the anatomical position is what? As you can see here, the position of reference for studying, for all the movements also called the standing supine position. You can't make the cadaver stand. So basically, if you want to stand in anatomical position, so you can get up, stand straight, head straight, facing front, palms facing in front. Palm facing in front. This is anatomical position as you can see in the picture. So this is anatomical position. So whenever we say something is superior, something is inferior, something is lateral, something is medial, our reference is in which position? Our reference is in which position? Whenever we say superior, inferior, lateral, medial, our reference is anatomical position. Our reference is anatomical position. In that position, you are going to study it. Am I clear? So after giving the definition of anatomical position, let's understand some directional terms used in describing anatomy. Like the first anatomical term, directional term is superior. What is superior? Anything in your body which is towards head is superior. Am I clear? Anything in your body directed upwards or towards the head, we will call it as superior. Similarly, which is directed towards the feet is inferior. Now tell me guys, your stomach is what to your heart? Come on, answer me. Exactly. Good guys. Right answer. I am waiting for the answer. I am waiting for the answer in the YouTube. Come on. If superior is towards the head and inferior is towards the feet, what is your stomach with respect to your heart? Stomach is inferiorly located to your heart. And similarly, when I ask you, what is heart with respect to your stomach? You will say, sir, superior, upside. Am I clear, everyone? Are you getting this? So while studying, some things are above, some things are below. Superior, inferior. Your nostrils. Do you understand? These openings of your nose are called as nostrils. Nostrils are superior to upper lip or inferior to upper lip. What word you will use here? You will use the word superior. See, nostrils are superior to the upper lip. Am I clear? So like this, many different words we are going to use in with respect to superior and inferior. Going ahead. Next, anterior and posterior. Something facing in front is called as anterior, and something facing on the back is what? Posterior. So tell me guys, your vertebral column which is supporting your back, is it anterior or is it posterior? Come on. Simple here. Come on, simple answer. Your vertebral column is anterior or posterior? Posterior. Exactly. Yes. What about your heart? Is your heart anteriorly located or posteriorly located? Heart is, come on, anteriorly located in the front. What about kidneys then? What about kidneys? Kidneys posterior, पीछे है. Kidney इधर पीछे है, on the back side. Okay, so here we are describing the anatomical position. What is anatomy? What is the anatomical position? Anatomical position is a anterior position where the palms are facing anteriorly in front. Where the palms are facing anteriorly. Yes, beta. Am I clear? And moving ahead, after these four words, let's see another words. Another words. Next, medial. What is medial? Come on, read it. Nearer the midline of the body. Nearer the midline of the body. This is our midline of our body. This is the midline. Come on, guys. Now answer me. Is your nose medial or your ears are medial? What is more medial? Nose are medial or ears are medial? Medial means which is located near the midline of the body. This is the midline of the body. What is medial? Nose is medial or ears are medial? Come on. Nose are medial. Ears are laterally located. Ears are laterally located on the head, where the nose is located medially. Yes, eyes are also located lateral to the nose, and further lateral to the eyes is ear. Understanding, guys? Yes, Dheeraj, you can also say bilateral. Ears are bilaterally located to the medial nose. Yes, some students are asking me, sir, can I say heart is also medial, anteriorly and medially located between the lungs but tilted towards the left side? Heart is located medially between the lungs but tilted towards the left side. So can I say lungs are lateral to heart and heart is medial to lungs? Both statements are correct. Are yes or no? Are you getting me, guys? Are you able to understand these words? Come on, are you able to understand, guys? Come on, tell me yes or no. Are you going to get this? Beta, cryptogram question, I am coming back to you. So if you are understanding this, very nice. Okay. When you go to doctor and doctor checks your pulse, doctor checks your pulse, yes or no? They basically use the 3-finger method here and they put here and check the pulse, yes or no? They will put and check the pulse here, yes or no? So now tell me, guys, if I am in anatomical position, here you can check your pulse, you can feel an artery here, radial artery. Tell me this radial artery here where you feel the pulse, just use the 3 fingers and put little pressure, you can feel the pulse. Is this artery medial to body or lateral to the body? Come on. This artery here, is it medial to the body or lateral? Come on. It is lateral, lateral, lateral. So radial artery is lateral. Am I clear? I can say your limbs, upper limb and lower limbs are lateral to your body, laterally located. Yes, everyone? And what about your rib cage? What about your rib cage? Are your rib cage laterally situated or medially situated? Medially. Medially, made by the ribs and all. Yes or no, guys? So many places you are going to use medial and lateral. Lateral is farther from the midline of the body. So this is the midline of the body. Anything closer to the midline is medially located. Anything little away from the midline is laterally located. So if two structures are there, one structure is close to the midline, other structure is far away from the midline. So one which is closer, you will call it medially located. One which is little far away from the midline, you will call it as laterally located. So whenever you are saying medial or lateral, you have to give the reference point also. You have to give the reference point. Like when I ask you ears, I told you, I gave you the reference point with respect to nose. With respect to nose, it is lateral. But nose with respect to your medial line is passing through the midline, so it is present medially. It is present medially. Are you getting me, guys? So after medial and lateral, next two words, proximal and distal. Whichever is nearer nearer to the attachment of a limb to the trunk is called as proximal, and which is far away located from the trunk. This is your trunk. This is your trunk. Yes or no? Your thorax and abdomen is the trunk here. Which is more closer towards the trunk is proximal. Far away from the trunk, distal. So, your arm bone, you might be knowing your arm bone. Limbs are your hands. Upper limbs are your hand. Lower limbs are your legs. Yes? So, coming to nephron also. Anita, coming to nephron also. Trunk means this middle part, beta. The thorax and the abdominal part of your body is trunk. This is your head and this is your trunk. Yes? So whichever is nearer to the trunk, you will call it as proximal. Which is far away is distal. Many students have started in the chat box. Proximal, distal, convoluted tubule. I will come to that. I will come to that. Hold your horses. Hold your horses. Now if I tell you here, this is humerus bone. This is humerus bone. And this is your radius and ulna in the forearm. This is forearm and this is your arm. In arm we have humerus. In the forearm we have radius ulna. So tell me guys, which one out of this is proximal? Is humerus proximal to your body? Or radius or ulna is proximal to your body? What you will say? Which is more nearer to the trunk? More nearer to the trunk is your humerus bone. Humerus is more nearer to you. That is what guys? That is your proximal. And radius ulna little far away, they are distal. Now many students are talking with respect to PCT and DCT. What they are talking with respect to? PCT and DCT. Now if you remember, you have studied the Bowman's capsule, the PCT, the loop of Henle, if you remember. Yes or no guys? Roughly, I am showing very roughly a diagram of nephron. Yes? So this is the renal tubule, here you have the glomerulus. Okay? This structure you call it as what? You are saying this structure is PCT. And this structure you call it as DCT. PCT, DCT. Now, this is the main part where the urine filtration is occurring. This you called as the Malpighian body. This is the main structure. Na? You call this as Malpighian body. You call it as Malpighian body. Made up of Bowman's capsule and glomerulus. Now, with respect to Malpighian body, which tubule is nearer? Which tubule is nearer? Nearer one is this one. And it is coiled. Coiled means convoluted. That's why it is called PCT, proximal convoluted tubule. Proximal, nearer. Coiled, convoluted, tube-like tubule. And which one is far away? Which is far away from your reference point. Reference point is Malpighian. Far away is DCT. So distal, convoluted tubule. Are you understanding me, guys? Proximal and distal. One more example I will tell you. Right now, are you proximal to me or distal to me? Physically, what you will say? Physically, what you will say? Are you proximal to me or distal to me? You are distal. When you come in front and sit here in front of me, then we will be proximal. Proximity, proximal. Proximity, proximal is to be near. Distal means to be little away. So again, this proximal and distal words we are going to use when we are going to study the human organs, human body parts. Are you getting me? Am I clear? Proximal, distal, did you understood? So anything closer to your trunk is proximal. Anything far away is distal. Am I clear, guys? Acha, tell me something. In winter, you experience, in extreme winter, when you are facing too much of chilled, or your room where you are sitting is very much chilled, What happens to your nose tip and ear tip? If it is very cold room, what happens to your nose tip and ear tip? What happens? Does it feels very cold? Becomes very cool, yes or no? Cools down. It's freezing cold. Like if you touch your nose in very cold room, it's very cold. Your ear tips are also very cold. Your fingers also become very cold. So the body parts, listen carefully. In winter season, when it is very cold, your distally located body parts, fingers, finger of feet, nose tip, ear tip, they are becoming very cold because blood supply is very less. Whereas your proximal part, the part which is nearer to the body, is little warmer. Yes or no? So distal body parts become cold, the body parts which are distally located and which are present closer towards you in proximity to your body trunk, they are warmer. Are you getting me, guys? So proximal is nearer proximity, distal is far away. Come on, let's move ahead. Enough of proximal and distal. Next. Now come to superficial and deep. Now let's understand that other two words, superficial and deep. Do you see some blood vessels on your body surface? What are those blood vessels? Tell me. What are those blood vessels which you superficially see? Little greenish in color, sir. We have red color blood, but this blood vessels are appearing very greenish or bluish in color. You call them as veins. Yes, sir. Is distal derived from the distance? Yes, Vaisali. Distal is derived from distance, which is far away. Distal, closer, proximal. Veins. What is the use of the veins? Tell me. You use the veins to remove some blood for a blood checkup. Whenever someone is admitted in hospital, we need to give some saline. Yes, some medicine directly. We apply one intravenous line. We apply one intravenous line here. So veins are superficially located. So you can find them, you can withdraw some blood for blood test, and you can also put an intravenous line for a person who is admitted. Can you see artery? Can you see artery, guys? No, you can't see artery, but you can feel artery. You can see veins, but you can't see artery, and you can feel the artery. So whenever the doctor, with the three finger again, press your hand here. Come on. With the three finger, press here. This is your thumb. Just below your thumb part here. Press with the three finger. Relax your pressure. You can feel the pulse. That pulse, what you feel, is the arterial pulse. Is the artery under the pressure. That is called as the blood pressure, which is due to the pumping action of heart. Arteries are deeply situated. Why so, sir? Why arteries are deeply situated? Arteries are running under a very high speed, under a lot of pressure. So if any injury happens, the blood may splutter out. The blood may get ejected out very rampantly with a lot of force. That's why to protect those important blood vessels, arteries are deeply situated, veins are superficially situated, because no one is pumping in veins. The pumping of blood only happens in the artery. Yes, exactly. So veins are superficially situated. If they get injured also, some blood loss may occur, but veins are easy to treat and stop the blood vessel. But in the hospital, when we get a case where arterial damage is there, blood Vessel flow is not stopped very easily. We have to be very careful. Immediate treatment is required, or the person may lose a lot of blood. So if sir artery is cut and anesthesia is given, what would happen, sir? No problem. You have to quickly repair the artery, or else the person will lose the blood. But vein, you can take some time and treat. So veins again, what is the concept here? Superficial and deep. Superficial, located near the body surface. Tell me, are your sweat glands superficially situated or deeply situated? Come on, answer me. What about your sweat glands? Come on. Where they are situated? Superficially or deeply? Superficial. That's why it comes out. Along with sweat glands, which other gland you have studied? Along with sweat gland in the skin on superficial surface, which other gland is there? Superficial, along with that is sebaceous gland. Very nice. Now, what about gastric gland? What you will say? Gastric glands, pancreas gland, liver. What you will say? Like gastric glands in stomach, they are deeply situated. Yes. So sometimes person may get a superficial injury, or sometimes the person may get deep injury, which is situated inside. Am I clear, everyone? So superficial and deep. Am I clear? So sometimes you get injury, some bleeding occurs through capillaries. So capillaries on your distal body parts are superficially located. Artery is deeply situated. Veins are superficially present. Sweat glands, sebaceous glands, they are superficially present. Tear gland, superficially present. Am I clear? Sir, is the vein anterior to the artery? Anterior nahi bol sakte, Rizwana. You can say that veins are superficial to artery and artery is deeply situated when compared to veins. ठीक है? Now all these are the describing terms. As you can see, superior facing head, inferior facing the feet, medial facing the midline of the body. Medial means facing the towards the midline of the body. Proximal means towards the trunk. Away from the trunk, away from the trunk, away from the trunk, distal. Away from the trunk, distal. Towards the trunk, near the trunk, proximal. On the surface of body, superficial. Deep inside the body, deeply situated. I hope you are understanding. Front is anterior. Can you tell me one more word for anterior, what they have given here? Anterior, can you read and tell me which one more word is there for anterior? For anterior in front means one more word. Come on, tell me. Ventral. Ventral is front. Dorsal is back. Ventral is front. Dorsal is back. Another word added to your dictionary. Anterior is ventral. Anterior, front, ventral, one and the same. Dorsal, back, posterior, one and the same. So when you are patting a dog, imagine you are patting a dog, okay? So which surface of the dog you are touching? On the back. Is it dorsal or ventral? It will be called as dorsal. Am I clear, everyone? Am I clear, everyone? Yes or no? Yes? Chaliye. Let's move ahead. Now that was all about different anatomical positioning terms. Now what we are going to study? Now we are going to see the plane and axis. What is a plane? What is a plane? It is the surface or place on which movement occurs or takes place. I will say all the plane names. Don't worry, Dheeraj. There are total 3 planes. We are going to see all the planes. And you are very well aware of the axis. In mathematics, you must have done a lot of problems on axis, x-axis, y-axis. And we are living in 3-dimension. In 3-dimension, which axis comes now? Z-axis comes now. Yes. So what is axis? Axis is the line around which the movement takes place. The surface or place on which movement occurs or takes place is a plane. It is the line. Axis is the line. Plane is the surface. Understand? Axis is the line around which the movement takes place. Axis is always a right angle 90 degree of the plane. So if you have 3 axes, already you know 2 axes, x and y, another is z. So on this 3 axis, we are going to have 3 planes on which the movement occurs. Okay, very simple. 3 axes and 3 planes. And the planes are situated on this axis. And your movement is occurring on this plane. Am I clear? So let us see what are the different planes. Okay. Are you able to see, guys? Are you able to see? These are the 3 axes, x-axis, y-axis and z-axis. Everyone able to see this? Okay. Come on, let's go ahead. So as I was telling you, there are how many planes? Come on, guys. How many planes? 3 planes. What are those names? Sagittal plane, frontal plane, transverse plane. How many axes? 3 axes. Sagittal axis, coronal axis, vertical axis. So till the time you are not going to see those axes and planes, these words will be little challenging. These words will be little challenging to you. So let's see the planes first. So basically there are 3 cardinal planes. How many planes? 3 cardinal. Now what is cardinal? Cardinal means main, fundamental, important. What is the meaning of cardinal? Many students will ask, what is the meaning of cardinal? Cardinal is 3. Cardinal means fundamental, main, important. 3 important planes are sagittal, frontal and transverse, as you can see in the picture. Tell me, looking at the picture, tell me which plane passes through horizontal axis? Which plane passes through horizontal axis? Tell me. Which plane will pass through horizontal axis? Which plane passes through horizontal axis? Come on. All the samurais. Samurai कैसा करता है? Samurai ऐसा blade लेके ऐसे swings like this. Yes or no? So when samurai cuts like this, it's which plane we are moving? We are moving on the transverse plane. And transverse plane is your horizontal plane. Okay? Now tell me. This is my katana. Katana is a blade. Okay? Now I will cut like this. I am going through which plane? Come on. When I am going like this, which plane I am passing through? Come on. Which plane I am passing through? This plane. Which is this plane name given here? What is the name given here? Sagittal plane. Which plane? Sagittal plane. Yes, everyone? So how many planes we have saw? One is this plane, that is your horizontal transverse plane, passing through head to foot, passing through the midline. Passing through midline. That is which plane? That is sagittal plane. And last, third plane. I have to move like this and I have to cut like this, going like this from the front. First I went like this. Okay, first we were having horizontal plane. Then we are having what? Then you are having sagittal plane. Then what we are having? Then we are having our coronal plane or frontal plane. Okay? Let's read the definition. Sagittal plane divides the body into left and right halves. So when I cut like this, I am passing through the central axis, dividing the body in 2 halves, right and left. Am I clear? Exactly, Oppo Reno, whatever your name is, Oppo Reno phone name is given here. Medial plane is your sagittal plane. Am I clear? Yes. Then frontal. Frontal divides the body into front and back. Yes or no? Frontal will divide the body into front and back. So this is the front part and this is the back part. How I will divide this? When the plane passes from here. When the plane passes from here, front part separate, back part separate. That is frontal plane. Frontal plane is also known as coronal plane. Okay? And lastly, horizontal plane. That is your transverse plane. When you cut like horizontally, upper body part and lower body parts are separated. Now someone is asking me, sir, to study this plane, are you going to cut the body like this? To study the sagittal plane, are you going to cut like this? To study transverse plane, are you going to cut like this, sir? We do cut. We do cut. But not in reality. But not in reality. No, Vaisali, I am answering all questions, beta. In reality, we are not cutting in these planes. Tell me, in which medical device we cut the body into different planes and study? Yeah, virtually we do this. Virtually in which medical diagnostic test we do this? Not X-ray, beta. Not X-ray. CT scan. Use the word CT scan. Computed tomography, which is a 3D CT scan, which is giving you images of your body parts in all the different planes. X-ray sometimes miss some tumor, which is deeply situated. X-ray sometimes miss this. X-ray is not covering all the 3 planes. Or you have to take 3 separate X-rays for the 3 separate planes. Still sometimes you will not be able to see what is there in the middle of the body or the organ. So CT scan, which gives you image. MRI scan also, CT scan also can show you the images in all these 3 planes. So you can easily see any problem, any defect, any tumor present anywhere. So CT scan gives much more better visualization. Yes, it uses radiation also, X-ray, but obvious X-ray is used in CT scan. Am I clear, everyone? Are you getting this? So sagittal plane divides the body into right and left. Frontal plane, frontal plane, frontal plane. Frontal plane divides the body into front and back. And then which plane? Horizontal plane, transverse plane, upper half, lower half. Now let's see the different names. Once you have seen the picture, let's see the different name. Come on. Sagittal plane. Sagittal plane is which plane, guys? Sagittal plane is this plane, yes or no? This plane passing through here is sagittal plane. It is also known as anterior-posterior plane. This plane is passing like this. Anterior-posterior plane, passing through the midline of the body. That's why also called as median plane. Passing longitudinally, passing vertically. That's why also known as longitudinal or vertical plane. Sir, do we study organs in this plane? Yes, you study organs in this plane. In your life processes, if any brain diagram is present, that is a sagittal section. It is a sagittal section view, what you are looking at the diagram. Remember the diagram which we see? Yes or no, beta? Aisa diagram. I will just show a rough diagram, okay? Don't have much time here. So the diagram what you see like this of the brain, yes or no? Which diagram is this, guys? Tell me. This diagram which you see, this cross section, this is sagittal section. Am I clear? So how to take sagittal section of brain? Like this, the plane is passing like this. The plane is passing through the center. Am I clear, everyone? Yes. So sagittal section view, what you see for brain. Am I clear, everyone? Similarly, you might have seen the kidney diagram also. ऐसा kidney diagram भी देखा होगा आपने? अरे yes or no? Some kidney diagram might also seen. In kidney, what you show? In kidney, you show pyramids, na beta? In kidney, you show the pyramids also. Yes. Now, what is this diagram? Exactly. Yes, Alfia. Yes, Dheeraj. Everyone is answering right. This is LS, longitudinal section. Longitudinal section passing longitudinally. Okay. And what is longitudinal section we just saw here? Longitudinal section हमने क्या देखा बेटा? Longitudinal क्या देखा हमने? Longitudinal is sagittal. So different planes are used to study the organs. Yes or no? Heart diagram, you know heart. Heart, two upper chamber, atria and ventricles. When you visualize the internal structure of heart, you cut the heart like this. This is which plane? This is frontal plane. Am I clear? In frontal view, you cut open the heart into front and back and you see inside. Am I clear? Yes. Next, frontal plane is mediolateral plane or lateral plane or vertical plane again here. So basically sagittal plane, frontal plane, vertical plane are commonly. Transverse plane is horizontal plane, and horizontal plane can be also called as latitudinal plane. And then we have the three axes. The three axes are sagittal axis, coronal axis and vertical axis. The axis through which the sagittal plane passes. Sagittal plane passes like this, it is the sagittal axis. Frontal plane passes like this, frontal axis. Horizontal axis is this through which the transverse plane passes, and that's why it is also known as the transverse axis. Am I clear, everyone? These are your planes and axis. Come on, let's see further. Now, what are axes? Once I have told you the planes, now let's see what are axes. Axes are used for anatomical reference, to study the anatomy. An imaginary axis of rotation. An imaginary axis of rotation. Plane on which surface it happens. An axis is for rotation. An imaginary axis of rotation that passes through a joint which is attached. So we have three axes. X-axis is frontal axis, Z-axis is the sagittal axis, and Y-axis is the longitudinal axis. So how you will write? You will quickly draw the XYZ axis. Y, X and Z you will draw and quickly name them. X-axis is frontal axis, Z-axis is sagittal, and longitudinal is Y-axis. Movement of the whole body and the segmental takes place in the cardinal planes around the cardinal axis. So when I am moving, beta, see, whenever I am moving, we are moving our hands, we are moving our fingers. Any movement we do, we are either doing this movement out of the three planes and out of the three axes. So what this line means, any movement of body takes place along these three planes, transverse, sagittal and frontal. Yes. And it happens around what? It happens around the cardinal axis. So three cardinal plane and three cardinal axis. These are the main important things which we need to understand. So first plane is sagittal plane, also known as anterior posterior plane or the medial plane or vertical plane. In the sagittal plane, the imaginary line passes front to back and divide the organism or body part into two symmetrical halves. What? Two symmetrical halves. So if I say you, I am a human body here, and you want to see two equal symmetrical halves, the line will pass from the center, this plane. This is the axis, and the plane which is passing is your sagittal plane. It will divide the body into two equal halves. That's why many organisms, when in their sagittal plane, when they show two equal symmetrical half, which symmetry you say for that in animals? You use the word bilateral symmetry. You use the which word? You use the bilateral symmetry. So sagittal plane is an anatomical plane which divides the body into right and left. And if the right and left are equal, it is showing a bilateral symmetry. Which symmetry? Bilateral symmetry. And what is the axis? Axis is the frontal, also known as lateral axis, or the coronal axis, or the x-axis. These are the two axes through which it is passing. Clear, everyone? Moving ahead. See this sagittal plane. Come on. Again, look at the picture. What is the plane passing through? The plane is passing anterior posterior. Yes or no? Look at this, guys. The plane is passing through anterior, posterior. Come on. This here what I will write, tell me. Here I will write anterior. Here I will write anterior. Here I will write what? Posterior. Where is the plane passing through? The plane is passing through anterior posterior axis. The plane is passing through the midline of the body, dividing the body into right and left half. Yes or no? This is your sagittal plane. Similarly, when it is passing through this plane, transverse axis. Which axis? Transverse axis. Then what is this plane? Horizontal plane. And when it is passing through your head like this, dividing the body into front side and back side. Dividing the body into what? Dividing the body into front and back. This will be which plane? This will be frontal plane. So sometimes we study in sagittal plane, sometimes we study in horizontal, and sometimes we study frontal plane. Am I clear, guys? Yes? Okay, moving ahead. And look at this pictures, this GIF for a few seconds. Are you looking at the planes, guys? Which is this plane? Come on, tell me. My finger is pointing towards which plane? Come on. The finger is pointing towards which plane? Come on, answer me. What is this plane? This plane will be your... Come on, answer fast, guys. See, carefully see the plane. This plane is dividing the body into front and back. This plane is dividing the body into front and back. This is frontal plane. Now pay attention here. Now look here. Here the plane is passing through the midline of the body. Where it is passing through the midline of the body. This will be called as sagittal plane. And here, if you see this plane, lower plane here, this is dividing the body into upper half and lower half. This plane will be called as horizontal plane or the transverse plane. Correctly said. So transverse plane, frontal plane, sagittal plane. Am I clear? Am I clear, guys? Okay. So these are the respective planes. So three planes: sagittal, frontal, and transverse, that is horizontal. Moving in how many axes? Showing in how many axes? 3 axes in total. Showing in how many axes? 3 axes in total. So different plane provide different movements. Different plane provides different movement. This is just for example. See, this is just for example, guys. End of the day of class, you should just know what are the 3 planes, what are the 3 axes, what are the name of the planes, what is the other name of the axis, and lastly, the anatomical position direction: superior, inferior, proximal, distal, medial, lateral, superficial, deep. Am I clear? And then the 3 planes and the 3 axes. Here, just for your further understanding, I have given some examples here. Sagittal plane movement is in squatting, walking. Yes? So when you are walking, when you are running, when you are cycling, which plane you are moving? Which plane? Walking, going front. So this is the plane. You are going through the sagittal plane in front. Yes? So some movements are sagittal. What is frontal plane? Also known as the lateral plane or the mediolateral plane. See, frontal plane passes through here. Look at this pen. This pen is passing through here. Here. Mediolateral plane. Also known as coronal plane. The axis is sagittal axis or anterior posterior axis. Look at the frontal plane. This one. This is the frontal plane. Dividing the body into front and back. Okay. And what is the purpose of frontal plane? Frontal plane movement, come on, all adduction movements, radial ulnar deviations, abduction, adduction, abduction and adduction. Yesterday I told you, take your hand away, take your hand close. Now answer me, guys. When you are taking your hand away, is your hand going laterally or medially? When you take your hand away, is it going laterally or medially? It is going laterally. And when you are bringing it back, it is coming back to the midline, close to the midline. This is medial. So which plane is this movement? This movement, taking your hand away, abduction. Taking your hand again back to close to your body is adduction. Away, abduction, towards the body, adduction. But which plane, beta? Which plane? This plane. This plane is frontal plane. Am I clear? Yes? Or you can do like this. Take your shoulders up, take your shoulder down. Take your shoulder up, take your shoulder down. This plane, it is moving in this plane. This plane is which plane? This plane is which plane? This is the frontal plane. Elevation of the shoulder, depression of the shoulder. Elevation of the shoulder, depression of the shoulder. Elevating, taking it up, depression, going down. This is frontal plane movement. And now, lastly, let's quickly see the transverse plane. That is the horizontal axis dividing the body into upper and lower half. Yes, this is your transverse plane dividing the body into upper and lower halves. Let's see the example of the movements. What movement you will see here? Supination, pronation. Supination, pronation. Take your hand up, palm facing upwards, palm facing downwards. Palm facing upwards, palm facing downwards. When your palm is facing upward, downward, this is moving in which plane? This is moving in transverse plane. Which plane? Transverse plane. So, understanding all this rotation, pronation, supination, this will take some time. Okay? So, even if you don't understand these examples, it's okay. But only thing is that why I'm showing you the examples is just to understand or relate some examples in reality. For your level, all these things are not required. For your level, just the directional term which I gave you, superior, inferior, distal, proximal, superficial, distal, the three planes and the three axes, that's all you should remember. Okay, so someone are saying, sir, you are going very fast. The thing is that I've just to show you the examples. But in reality, very minimum things you should learn from this class. And I told you what you should know. Because my duty is to show everything. What are the examples? Am I clear, everyone? And lastly, I will show you one last picture which I needed to show you. This one. Just read this line. Come on. What is the line saying here? The cardinal axes. Cardinal means the main axes lie at the intersection of the cardinal planes. Wow. So what is this definition telling you? Here you can see three planes. Here you are able to see the sagittal plane. Here you are able to see the frontal plane. Here you are able to see the transverse plane. And all the planes are intersecting. Can you see the point here? All these planes are intersecting at this dot. And this dot is nothing but where all the planes and axes intersect, and here will be our center of gravity. What is this here? Center of gravity. So our most of the mass is situated just near your belly button. Your belly button is the center of mass. So this picture, final picture, shows everything. All the three frontal planes and all the three central, all the axes intersecting at this common point. Am I clear, guys? Am I clear? And definitely, I am going to share this picture and this notes with everyone. Okay? I'm going to definitely share this with all of you. But remember, guys, what I'm telling you, what is more important here? What is the takeaway from the class? Takeaway from the class. Takeaway from the class is the directional terms. Takeaway from the class is the directional terms. Directional terms such as superior, inferior, lateral. Okay, I'm just writing it roughly. Medial, distal, proximal. And another things, the three planes and the three axes. That's all. In the three planes, sagittal, frontal and transverse, that is horizontal plane, and the three axes. Am I clear, everyone? This is the only thing is the today's takeaway from the class. Remaining thing, this PPT, the presentation, and along with the PDF which you wanted for the terminologies, the prefix and suffix, the root words, I am going to share that as well. Okay. So till that time, see you soon. Take care. God bless you guys. I hope you enjoyed the class. Little learning was there today. Some might student have find it little difficult to understand the topic, the planes and all. Yes, it is difficult though. But again, when we start our first class, again I will give you a very quick revision. Whatever the planes and axis and everything's, I will tell you that also. Am I clear, guys? QR code of the PPT will not come, Dikshita. Okay, these are the ready-made PPTs, na? So better I will share with you everything. Okay, distal to the class, proximal to physical. Exactly. So I hope you understood today. See, angiosperms I told yesterday. What are angiosperms? Angiosperms are flowering. So what about cryptograms? Crypto means hidden. What do you mean by crypto? Crypto means hidden. Crypto means what, guys? Crypto means hidden. Am I clear? Like in gymnosperms, you just see the seed. There is no flower. In angiosperm, you see the flower along with the seed. Yes. And in cryptogams, the algae and the bryophytes and all, the reproductive organs are hidden. So cryptogams. Okay. Further, you can understand in the botany class as well. So that's all for today's class, guys. I hope you enjoyed the class. Sir, even sagittal plane and frontal plane, no, they are different. They are vertical because they are passing through vertical axis. Supraja, they are passing through vertical axis, that's why. Sir, if crypto is hidden, then cryptocurrency is also hidden currency. Correct. Now you are getting it very right. Okay, guys. Thank you. See you soon. All the best. Bye, guys. Take care. Bye-bye. 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 Thank you, guys. Thank you. Thank you, everyone.